See? Hi, all right. So happy Saturday, everyone. This is Dr. Jenny, Youssef, physical therapist and Dr. Physical Therapy. By the way, this is for the Thanks God, it's Thursday. So today, we're going to feature Asha Gumadi. And by the way, for people who doesn't know me, I'm Dr. Jenny, Youssef, physical therapist and Dr. Physical Therapy. Creator and founder of Balance and Fall Support Group in Aging Adults and Physiogen PT and Wellness. So for the Thanks God, it's Thursday, we will feature Asha Gumadi. She is a physical therapist and also a Master of Science in Neurology and a board certified clinical specialist in neurology, right, Asha? And she's also the national founder of Geographic. Yeah, I can see that you hang. I think the internet. Mm-hmm. Let's see. Oh, you're back. Okay. All right. So, Asha, tell us more about yourself.
Hi, Jenny. Your voice is breaking up.
Mm-hmm. Yeah, I saw that the signal was weak a while ago. Are you? Can you hear me well?
Jenny, could you hear me?
Yeah, I can clear. I can hear you clearly.
Okay.
Yeah, and a while ago it's like weak signal. That's what they said.
Okay.
Can you hear me well?
I'm doing good. How are you?
I'm good, good. Can you hear me clearly?
Yes, I can right now.
Okay, yeah. So tell us about yourself, Asha.
Hi, everyone. Thank you for having me, Jenny. It's nice of you. So myself, I am Asha Gumadi. I am a physical therapist with around 15 years of experience. I'm a neurological clinical specialist. I'm also trained in vestibular rehabilitation through Emory University. And I treat patients mostly with neurological diagnoses and also geriatric clientele and patients who have concussion or vestibular disorders. I'm also the founder of TherexPortal, a web application that helps physical therapists reach and treat patients remotely through telehealth and online digital exercise prescription. So that's about me.
That's really good. This morning, last Saturday, I featured and then do a blog about telehealth. And then, yes, I discussed about the telehealth and the different platforms available nowadays. So it's very important we use this innovation, this technology. So what can you tell us more about this Therex Portal? So congratulations, you're the national, what do you call that? National Geographic awardee for the Genius Chase Challenge, right?
Yes,
so
yes.
You won from this innovation?
Yes, that's right, Jenny. So National Geographic has partnered with Sprint and they hold an annual competition for innovations. It's called National Geographic Chasing Genius Challenge. And this innovation of Therex Portal has won the first place for empowering telerehabilitation with digital connectivity.
Mm-hmm.
Thank you. Thank you for congratulating.
Yeah, this is really amazing. So I have many colleagues and I am planning of adding it in my practice, the telehealth, and I know how important it will be. So there are many benefits of using telehealth in our practice, reducing the caregiver burden, regarding the time constraints that we have when there's a weather constraints. So our client can stay at home, especially our homebound clients, doesn't need to travel. And then especially if they have taxing effort going out, you know. So tell us more about what is the difference between the other portals or platforms that we have. So can you explain us more? I have some colleagues asking about it as well, so we can describe it to them.
That's great. I would be happy to let you know about this. So for all the reasons that you have explained, definitely, telehealth is a good platform for us to reach patients, especially neurological and geriatric clientele who have those extra caregiver burden to bring them in, especially if you're going to a client visit, like if you're making an effort to reach a physical therapist, even though you spend only an hour at the physical therapist, you practically take half a day off to attend the therapist, for transportation, go home, leave the home and then come back and travel through this traffic and everything. And it adds up to the caregiver burden and also the financial cost of the patient, because these are all extra efforts from the patient. And there was a study done on Parkinson's patients who took the LSVT. You might be aware of it, and they calculated the cost savings of caregiver costs from taking the telehealth visit at home to an actual treatment visit to a therapist, and they have like astounding savings from it with the similar outcomes achieved. So for those reasons, telehealth is quite beneficial. And also, if you're thinking about your orthopedic busy clients who have like a full-time job, it might get very tedious for them to take like 2 days a week to take time off from work and then go to telehealth and go to see a physical therapist. And restricting them before and after the day, like the end of business hours, would also be difficult for them to get that schedule squeezed in. So this is a good alternative even for orthopedic patients who have a busy life.
That's really good. Yeah. So you're saying that neurological, such as Parkinson's, stroke education as well, right? Because it's almost the same. As you've said about the Parkinson's, I saw it. I read it in the journal. I have it here. In Journal of Neurologic Physical Therapy. So it says there that home exercise program, and in addition of the telehealth. So with that, they're doing the exercises and the compliance improve because we need a follow-up. So
Right.
the problem is they go to the clinic and they don't do exercise at home. So with the telehealth, the home exercise programs, compliance improve, and they overall results improve, the gait and everything.
That's absolutely right, Jenny. And I haven't answered your second question about what difference does this platform make compared to the other platforms, right? So me being a neurological clinical specialist, we spent a lot of emphasis on caregiver education.
Okay.
And the right reasons, when I visit when the patient visits me, right? So to get that neuroplastic changes, to drive that neuroplasticity, I need about 2,500 repetitions of upper limb reach, or at least like 9,000 to 10,000 steps of walking every day,
Wow.
to get that neuroplastic change and make those functional outcomes. However, in a typical 1 hour session, you only get 292 steps,
Oh,
or
I
you
didn't know that.
you make like 18 purposeful reaches with your arm, So
Yes.
if the patient is treated through telehealth, and if we are empowering the caregivers and the patient take ownership, and then they do the home exercise program with better compliance, better adherence, and then they can drive those neuroplastic changes, which help them really well with their success and recovery. So I hope you can see my screen right now.
Yes, it's very clearly. Yeah, it's very clear. So this is the Therex Portal, right?
This is the Therex Portal,
Okay, cool.
and this platform is particularly used for physical therapists directly. And physical therapists basically log in as a clinician, and then they treat their patients online with this.
Okay.
And I'm just going to show you the digital exercise prescription in a second.
Okay. And give us your password.
For that reason, I just.
Okay.
So let me take you back here. I hope you can see it.
Yes,
So
it is.
yes, for the HIPAA reasons, I didn't show my patient to you. So
Okay.
this is a demo patient. And you can see that as a physical therapist, it makes your life very much easier when you're treating your patients through telehealth. So our telehealth platform has a screen sharing feature. So what we do is we initiate the call through a link sent to the patient, which the patient can access. And they don't need to download any software or anything. They just click the link and they consent to the treatment, and then they are in the portal. So once they are in the telehealth one-on-one session, the therapist goes ahead and shows them all the conditions that they want to treat, or the
Wow.
stretches that they would like to have the patient perform. And while the patient is watching your screen, you can show them the actual demonstration of the exercise and have the patient perform the exercise one-on-one. Right now I'm speaking with you, Jenny, but if you can see this exercise and you can perform it, I can watch you in real time and then correct you if you are doing the exercise incorrectly.
Okay.
So
So
it
this is
provides,
in her screen.
yes,
And then
yes.
you can see me here, and
You
then
see,
I'm doing that stretching. Okay.
yes,
That's
yes.
cool, cool.
So, and I can also push this link to you through our telehealth platform. So you can have it, and I can also request your screen to be shown. So that's unique about this platform. And our most important feature is the native language integration. So if your patient speaks Spanish, you just click Spanish here in the
Wow.
language. You can see the exercise instructions in Spanish for your Spanish speaker. And we have several Indian languages integrated to this as well.
Yeah, cool. I work in Saudi Arabia and also Abu Dhabi. I have many colleagues, Indian colleagues.
Oh,
Yeah.
that's great.
I have a basic Indian knowledge, only the numbers.
Oh, that's good. That's good. And when we talk about adherence tracking, so our patients, we can see how many times they have logged in and how compliant they are with the exercise program. So if they have performed the exercises, you can see the percentage of completion of the exercise. Of course, this patient has not initiated the exercise, although he looked and viewed at the exercise. So if the patient clicks on exercise completed, then you can see that the patient has successfully completed the exercise. And it also gives some gamification tools for the patients to improve their participation in the home exercise program.
Okay, cool. Yeah, it's really good.
Thank you. And also adding to your need for caregiver education, we have
Yes.
teamed up with National Institute of Health. They have been kind enough to let us use their educational handouts that are meant for patients. And we have several education handouts. And I know, Jenny, you're big on falls, right?
Yes, yes.
So you can see like basic information like fall proofing your home, and this is from National Institute of Aging.
That's
How
cool.
you could better you know make your home fall proof, and they some videos as well. And for your general geriatric clientele, we can also help them with their balance and information on vestibular disorders and balance. So we can, use this platform to educate our patients and inform the caregivers. A well-informed patient has better chance of participating and owning the recovery better.
That's really good. Yeah, I didn't open it yet, this side. Okay. And they can print it well as
They can,
well? Okay.
yes, of course, they can print. Every exercise program they can print, they can view it, they can, we have an option to send it to them through a text message, through email, and also you can print it out with your own name and white labeling that we have. And this is about peripheral neuropathy, which is less spoken but widely, the incidence is great. And
Yes.
and for many patients who are post 70 years who have diabetes, chronic diabetes, we can see that peripheral neuropathy really impacts their balance and their
Exactly.
ability to perceive the floor, and is one of the contributor to falls. So, we have, several different tools to make our patients successful in their recovery.
Yeah, that's a good point. So here it says that geriatrics, you have dementia and also different good and under neurology. So what are the most common cases that you usually treat? You have neurology, right? So stroke, Parkinson. So what else the telehealth can treat?
Yes, so I have been treating patients with stroke and also vestibular dysfunction. Especially, I'm recently seeing a patient with concussion and also vestibular migraine.
That's good.
When patients have an active migraine, their tolerance to transport, commute is very limited. Like the driving triggers their symptoms even more. And if we want to help this patient be successful and provide them the tools required to succeed, then limiting their activity also is very crucial uh, when we are rehabilitating the vestibular disorders. And also when they have severe headache from motion sensitivity and too much information, busyness in the environment. So this really helps those patients in acute injuries or acute onset to limit their physical activity and also at the same time work towards recovery and get those gradual gradated exercises.
That's really good. So these are more on the home exercise portal. So is the Therex Portal home exercise different than for the telehealth?
Yes,
Or
so the telehealth um, is a part module of it. So let me show you the telehealth part of the Therex portal.
okay, so that's really amazing, Asha. That's beautiful.
Thank you.
Regarding, yeah, it's very
So,
clear.
mhm. So this is the telehealth portal of Therex portal, and here
Okay.
you have, as a new user, you can register, and we currently are giving every user a free access key. Um, it's Therex Telehealth. You can write it down, and I will also send you the
Okay.
key in your Facebook account. So
Okay.
if you use the access code, you can basically register for free.
Okay.
And when once you register, you have your unique login ID and password,
Yes.
and then you log in. And currently, I'm showing a test account for you. So when your patient receives a link, they would see a um, they would first go through the consent form. So having a consent form from your patient is really important for a successful telehealth visit. And there are different rules in different states. Some states require you or mandate you to have a written consent form. Some states say a verbal consent is enough. So if you were to keep yourself ready and be sure, if you already take a written consent form, then you are safe. So I would like to, whenever it comes to the legality issues and HIPAA compliance issues, it's better to be safe than to be sorry.
Of
So I can see
course.
that the patient has accepted the terms and conditions. So,
Yes.
and if I click on the patient consent form, you can see the name of the patient, the location that they are residing in. So you can double check if you follow in the same state of practice of the residence of patient, because that's important as a provider to know that your patient is residing in the same state that you're licensed in. Uh,
Yes.
and the date the consent form is discussed, and we also detail and list out the risks and benefits of telehealth practice, um, confidentialities and their right to refuse treatment. So when once the patient agrees and you can see their signature, then it initiates the call. So then you can initiate the call with the patient, and you can continue treating the patient. And within the payment settings, you can establish your own Stripe account of your personal business, so you can collect fees from your patients directly.
Okay. So we just need to how to get a Stripe account.
So it's very simple. So if you have
Okay.
a bank account, we have a flow through Stripe that you just fill out some fields
Okay.
and it activates your Stripe business account. So you
Okay.
as a clinician have your own business account, which is linked to your personal bank ID and your SSN, I believe, so that you can collect fees and also be um, GDPR compliant.
Okay, cool. Yeah, that's really good. So, and then after that, they will be, so is there like, you can talk to the client at first what they expect, so they know that they will receive a link.
Yeah.
And what are the challenges that you encounter? Because not everybody knows how to set up, or is it easy? What's their feedback?
So with our platform, initially, it's a work in progress. So what I noticed is that there is a lack of awareness since, as you know, telehealth is emerging. More clinicians are interested, more patients are interested in it. We need to build the knowledge gap. So knowing that a BAA is required to uh, to be compliant with HIPAA is a challenge that we faced.
Mm-hmm.
So what's unique to our platform is we guide the therapist or clinician to be successful in maintaining all the privacy and security policies.
Mm-hmm.
So when once the therapist, the clinician registers, the first page they see is the BAA. So you go ahead and sign the BAA, and then you have your BAA in your account settings, and you can view it. And if you get audited, you have the information
Yes.
right? So, and if you were to bill your patients through a super bill, for some of these patients who want to submit to insurance after
Mm-hmm.
the telehealth session, if you fill this profile information and fill in the details in the super bill, you and
Mm-hmm.
your patient could receive a copy of the super bill. And the consent form and everything is right there for you to view. And when it comes to patients sometimes get alarmed when they think of a telehealth visit. So there is a lot more education that needs to be done, and
Okay.
from a patient side, so that they know that they could be successful with it. But when once the patient tries 1 or 2 visits, they absolutely love it because it gives them the independence and also the tools required to succeed. And some patients actually like the telehealth better than the in-person visit because they're
Mm-hmm.
at their own home, and you can see the challenges that they're facing in their own home environment and give them some tools and tips to modify their home situation.
That's really good. Yeah. So, what do they need? Only a phone and
They
computer?
all, yes, they need
Do
a
they
phone.
need computer if they
So
want like this?
if they have the computer, it's better that they can see the exercise in a bigger screen,
Mm-hmm.
but it's not mandated that you need a computer.
Okay.
Computer just makes you look at things in a bigger picture.
Yes, yes. All right. That's really good. So tell us more about the home exercise program, how much it costs. Let's say for us clinicians,
Yes,
where like me, I'm really interested of adding this in my practice.
sure. So this is our pricing. So the exercise portal is currently $15 per month, or if you
Mhm.
pay an annual subscription, you get a $30 discount um, right away. So it only costs you $150. And if you're a small clinic, then it multiplies. And if you're a large corporate hospital, we need to work with you. And for the telehealth, we have launched our beta version right now. So currently we are trying to have more clients try it and give us feedback. So for the telehealth, for all our clients who use the home exercise program, it's free for them to use as of now.
Oh, wow. That's amazing. So how can we connect with you? Thank you so much, Asha. These are really very, very good innovation. And the home exercise program, in addition of the telehealth, these are easy. So
Mm-hmm.
we have many different platforms. So we just want to point out that if you are offering telehealth, if you should be licensed in your state, and then
Yes,
this is a really good, and you can check that in FSBPT, and then there's a PT compact now that you can even going to able to treat in different state as long you're licensed, and it's included in the PT compact.
that
So
is.
tell us, Asha, how can we connect
So
with you?
yeah, you can reach me at ashagumadi@therexportal.com. That's my email ID. And you can always ping me on Facebook or LinkedIn. I'm available in, online most of the time
Mm-hmm,
on those platforms. But if you'd like to drop a personal message to me,
mm-hmm.
please reach out at ashagumadi@therexportal.com.
All right, thank you so much. Do you have any other suggestions or anything that you want to open up, tell us
Yeah, sure,
with our
sure.
balance and fall support group in aging
Sure, sure.
adults?
Sure. With our geriatric clients or with our older adult who have balance issues, balance is a constant effort that you need to put in. So even though if your balance improves after you get treatment for 3 or 4 months, keep maintaining those exercises, keep working on that strength, and flexibility and vestibular rehabilitation. So
Mm-hmm.
you have your balance and you maintain it at that constant higher rate, and keep yourself informed, aware, and engaged, so that you can keep staying healthy and do more.
That's really good. So the cases that we have more here are more in geriatrics. You have orthopedic cases as well, right? Inside the home exercise
Yes,
and
yes, we
also more on neurological
yes.
and
So we have
caregiver
hip,
education.
yes, we have hip replacement, knee replacement. We have shoulder rehabilitation, back exercises in the orthopedic arena, and we have vestibular, geriatrics, and neurology.
Wow,
So
this is amazing. Mm-hmm.
yeah, so it comprises a whole lot. And if you don't find certain exercises, we also have a module where you can upload your own exercises from your iPhone or any mobile device that you use.
Mm. Okay. All right. Thank you. So, guys, if you are looking forward to add telehealth in your practice, so this is another platform that you can use. I think I need to drink. So, platform that you can use. So, there's a home exercise program, and there's a now platform for telehealth. So, there are many other platforms there. And if you have any questions, we can connect you with Asha, and these are available for caregivers, for caregiver education, and also for the clients itself. So this is a team effort, or their caregivers can help you in checking this, and this is only a link, as she said, so that's easy to check,
Excellent.
you know,
Yeah,
so the compliance will be easier. All right, so thank you, Asha. Anything else? We're good.
that's good. That's good, Jenny.
Okay.
Thank you for having me.
You're welcome, and thank you for your time. I
Thank
saw that you just had a speaking engagement in India last time,
Yes,
right?
yes.
So,
I was invited by All India Institute of Medical Sciences, which is a top university in India, which is a non-profit government hospital. So I was invited to be a speaker there, and I like to teach and to educate patients. So whenever I visit India, I try to give a couple workshops to help clinicians
yes,
gain
yes.
skills, and it's a good experience for me.
That's true. That's true. I'm also a board member in Future Foundation. And
So,
also this is a Future Foundation is like, we're able to, when we go to Philippines, some of our board members or any alumni of Far Eastern University
oh,
try
nice.
to offer their expertise and offer some of the education for our different physical therapies like college, you know, so that's
That's
really
good.
really good. Yeah,
That's good. It
so
always
thank
feels
you.
good to give back. That's good. Yes.
Mm-hmm. So thank you so much again, once again, guys. This is Dr. Jenny, and I have Asha Gumadi, and we are board certified clinical specialists. I'm in geriatrics, and she is in neurology. We are always here. If you have any question, just check out Physiogen PT and Wellness page and Therex Portal for any questions about telehealth, and we can connect you with her. And thank you, guys. And this is your Thanks God. It's Thursday. Another physical therapist has been featured for the Balance and Fall Support Group. And thank you. Have a good day. Thank you,
Thank you.
Asha.
Thank you, Jenny.
Let me see. All right, let me check your recording. Oh, sorry. I keep I keep touching it. I thought it's a touch screen, my computer. All right. So thank you so much. Bye, guys.